Hi, everyone. This is Dr. Asamoah, Medical Director at Express MD Urgent Care again. In this video, I'll discuss the symptoms of an upper respiratory infection. So, what are the symptoms of an upper respiratory infection? First, must define exactly what an upper respiratory infection is. It is simply a contagious infection of your upper respiratory tract. The upper respiratory tract includes the nose, throat, sinuses, pharynx, larynx, and bronchi, or upper lung passages. As you can imagine, a variety of microorganisms can affect these different sites, leading to classic URI symptoms. By far, viruses are the most common cause of all upper respiratory infections. Specific examples of viruses include rhinoviruses, adenoviruses, Coxsackie viruses, parainfluenza viruses, and respiratory syncytial viruses, or RSV. These viruses as a group cause the common cold, which is the most well-known upper respiratory infection, or URI. Over 90% of all URIs are viral in nature, which is why antibiotics are not effective for the typical upper respiratory infection. The remaining 10% of URIs are caused by bacteria, including group A, B, and C beta hemolytic streptococci, Corynebacterium diphtheria, Neisseria gonorrhea, and Chlamydia pneumonia. The most recognized of these bacterial infections is group B streptococci, otherwise known as strep. Antibiotics are effective at treating strep throat and the other small percentage of URIs caused by bacteria. So now that we know what causes URIs, viruses, and bacteria, next I want to kind of describe the different types of acute upper respiratory infections. The different URI types are named according to the parts of the upper respiratory tract most involved in the infection. In addition to the common cold, some of the other typical URI types are sinusitis. Sinusitis is an inflammation of the sinuses, which leads to facial pressure and nasal congestion. Another URI type is epiglottitis. Epiglottitis is inflammation of the epiglottis, which is the upper part of your trachea. It's a flap of tissue that protects the airway from foreign particles that can get into your lungs. Swelling of this epiglottis is very dangerous because it can actually block airflow into your trachea. Another URI type is laryngitis, which is inflammation of the larynx or voice box, which causes a hoarse or raspy voice. Pharyngitis is another common type of URI, and pharyngitis is inflammation of the throat and pharynx, which typically results in a sore throat that's also red. And finally, bronchitis. Bronchitis is inflammation of the bronchial tubes. The right and left bronchial tubes branch off from the trachea before going into the right and left lungs. Bronchitis typically results in coughing and wheezing. So now that we've described all of these different conditions, we can finally address the title of this video. What are the symptoms of acute upper respiratory infections? So the most common symptoms of URIs are runny nose, nasal congestion, sneezing, a cough with or without wheezing, and mucus production. URI symptoms can also include sinus pain, a sore throat, and ear discomfort. Again, the thing to remember is that these symptoms are caused by inflammation of the mucous membranes in a particular part of the upper respiratory tract. 90% of the time, the microorganism is a virus, and about 10% of the time, it's a bacteria that's causing this infection. So, when you present to your medical care provider, how do they actually go about diagnosing the upper respiratory tract infection? Well, most URIs are diagnosed by a combination of the provider taking a good medical history and performing a directed physical exam. At times, testing can also be utilized to help with our diagnosis. Some of the important tests to help with URIs include throat swabs, such as a rapid antigen detection to diagnose group B strep very quickly. A nasal swab can also be very informative, as we can do PCR amplification of the nasal secretions, and that can be used to diagnose COVID or one of the common viral causes of the URIs. X-rays can sometimes also be very informative with the URIs. For instance, a lateral neck X-ray can be used to evaluate your epiglottis size to help in diagnosing epiglottitis, or your provider may decide to order a chest X-ray to make sure that you're not having pneumonia as opposed to just a bronchitis. So, once we have the diagnosis of the URI established, the, uh, the next natural question is, how do we go about actually treating URIs? Well, URIs are mostly treated for symptom relief. Again, because 90% of URIs are viral in nature, antibiotics are not helpful for the majority of URIs. So, some of our directed treatments for URIs include cough medicine to suppress your cough, vitamin C and zinc, especially early on during the URI infection, can help shorten the duration and the magnitude of the symptoms. Nasal decongestants, including Afrin, can help with nasal breathing. However, make sure to remember that you do not use the Afrin for more than 3 days in a row, because it tends to be less effective over time and can actually cause a rebound nasal congestion. Nice home remedies are also very useful for URIs, including inhalation of steam to help kind of open your nasal and sinus passages. Chamomile tea with honey and lemon is great for sore throats, as well as gargling with salt water can also help relieve the pain of swallowing. And of course, analgesics like acetaminophen or Tylenol, and anti-inflammatories like ibuprofen or naproxen can not only help relieve fever, but also help with sinus and ear pain. So finally, how can acute upper respiratory infections be prevented? Well, the best protection against URIs is all of the habits that we've actually been practicing during this pandemic. Frequent hand washing with soap and water or antibacterial liquid, as well as mask use. Remember, many people have noticed a significant decrease in colds or URIs over the last year with these interventions that we've been using. Most URIs are spread by way of respiratory secretions that are either airborne when you sneeze or cough, or that pass between hand to hand when you shake someone's hand or pat someone else on the arm. So, some of the strategies to utilize during this upcoming fall and winter season to decrease URIs will include Avoid being close contact with people who are sick. Wipe down objects such as remote controls, phones, and doorknobs that are touched by a lot of other people who are sick. Remember to cover your mouth and nose if you're the one who's sick and coughing. And best of all, just stay home if you're feeling under the weather. Do not go to work or school. Well, that wraps up this video. I hope you found this information useful, and please stay tuned for our next video.